Hello, friends, and welcome to our podcast series that we're calling Conversations. This is giving us an opportunity to take a much deeper dive into topics that were touched on by our panelists at the 2023 Annual Mental Health Awareness Breakfast. This is an event that is sponsored by Unity Point Health, along with their foundation, and Blackhawk Grundy Mental Health Center. So we're going to take the opportunity to invite each of our panelists in individually and give them an opportunity to share more information, because it was just too much to cover during breakfast. I think I joked that we needed brunch and lunch and maybe even happy hour to cover all of the things that we could have covered with the experts that we gathered. Today, I'm excited to welcome Chief Joe Leibold, who is the police chief in Waterloo. And Chief Joe, at the Mental Health Breakfast, we provided everybody at the tables with sort of biographical sketches of everyone, so they were able to read about you. Can you kind of just give some background to our viewers today about, your story and how you ended up as the chief of police in Waterloo?
Well, certainly, and thanks for inviting me to the breakfast. It was a first for me, and I really did enjoy it, and you're right, it did cover a lot of information in a very short period of time. I've been a Waterloo police officer since 1990. I got hired in Guttenberg for just a bit before that, and then came to Waterloo as a new officer here and was hired by Chief Kirsten at the time. And I spent my entire career here, 33 plus years now, with the Waterloo Police Department. I've served in multiple divisions, from patrol to investigations to administration. I've bounced all over the organization, supervisors, sergeant and lieutenant and a captain, and now currently, November of 2022, Mayor Hart appointed me to police chief, and I've served in that role since then.
Wow, that's wonderful. And when we chatted ahead of the breakfast, we were kind of talking about your efforts as the chief of police to maintain a healthy atmosphere, a healthy environment. And it's not just you. You mentioned the support staff, other city employees that kind of make it a healthy environment for the officers that we have in Waterloo. Can you talk, since you've had your whole career here, can you kind of talk about any changes that you've seen, like from when you started as an officer in Waterloo, as far as feeling supported, or have you felt thoroughly supported your whole career in Waterloo?
From a mental health standpoint, law enforcement's never really embraced it until I would say probably at least locally or even on the national level, kind of like society. It was kind of hidden for a long time. And I'd say probably in the past 10 to 15 years, we realize that we're not superhuman. We are also human beings with lives, family, kids, the issues that everybody, deals with on a daily basis, from bills to just life in general. And then add to that the stress levels we encounter helping everybody else deal with those issues. So I think maybe 10 years ago or more, we really started to at least have the conversation and lay out. We had an EAP program. We have these things. We have these things available. Really kind of started looking at calls officers went on, and we'd be like, supervisors would be like, yeah, maybe it wouldn't be a bad idea to hold just a little gathering of those officers with an EAP provider, just to let them know what's there and give them out. We never really mandate it, but we just open the door and say, hey, it's here if you need it. Come to it if you wish. Take care of yourself. And that's kind of been our message here in the last several years is, take care of yourself. If you need to, mental health is very important. We provide a lot of services to them, to the officers and to all our city employees, actually, just to help with mental health issues.
Right. And another thing that you had mentioned was how in the position of a police officer, those individuals need to be seen as stable. They need to be seen as healthy. They need to be seen as ready. So when you go forward with this attitude of take care of yourselves, we have all these resources here for you. Take care of yourselves. Is there any extra layer to that? Do you have things that you watch for if you need to encourage anyone that isn't taking advantage of getting support for their mental health? Do you do check-ins, or do you really rely on them to ask when they need something?
Well, we're not an extremely large department, so we have 130 some employees, and we keep a pretty good eye on each other. We're close. At a shift level, the shift officers are all close, so they notice that fairly regularly. It's each little shift operates kind of like it's family within a larger extended family, for lack of a better term. So they know each other. They get to know each other rather quickly and learn from each other, and they can read each other and be like, hey, what's going on? Are you all right? Are you feeling okay? Anything we need to talk about? And I think we do a nice job of keeping that sort of, we're a nice enough size that we can keep that kind of family cohesion at the shifts level, and kind of, when we're all together, it's like a family reunion in different families. Right. But when first shift and early swing and they're all together, it's different, but they're all kind of connected in a way that helps them recognize it in each other and themselves, quite honestly.
Oh, that's beautiful. So I'm going to go to my TV version of what it's like to be a police officer and when things happen. And I've seen on television shows how, some traumatic event, some incident that officers are involved in results in someone having to hand things over until they get a psych eval, or they have to have, like a debriefing or an ability to process some traumatic thing that they were involved in. Does that kind of thing ever happen in Waterloo? Do you ever kind of require officers to go through anything after a traumatic experience?
We will mandate some like intro to EAP kind of stuff. We bring the EAP unit to our training center once a year, once every other year, just to kind of introduce themselves and develop a feel. So there's at least that relationship kind of started to be built, so you're not having to try to build that relationship during a crisis. But TV does certainly, enhance things and make them more dramatic. I've never experienced a situation where we've had to, pull someone offline, so to speak, because of something they've experienced and, didn't think they were fit to work. We monitor it pretty closely, and the supervisors are good about making sure this agency and all agencies, all law enforcement officers go through trauma, and we monitor that and just try to make sure they're healthy.
Excellent. One of the other things that you and I chatted about ahead of the breakfast that we didn't have time to touch on then was the gathering of police chiefs. Was it from Eastern Iowa, maybe, that had been a tradition previously? It had gone away for a couple of years that we all lost in a lot of ways, and there might be a rekindling of that. And I know that you were, I'm interested to know if the police chiefs got together and how you're feeling about the Waterloo Police Force, especially from what we were talking about, just officers feeling supported, having your roster filled. What kind of impression did you get from other communities and what their police forces are facing?
Well, it was very interesting, especially for me, because I've never attended one before. But as a newer chief, I looked at it as an opportunity to network with chiefs that have been in the seats longer, and come to find out, Cedar Rapids is getting a new chief. Davenport's chief's fairly new. Marion's chief was fairly new. Cedar Falls' chief was fairly new. Dubuque's chief's fairly new. So all the gathering, most of us were fairly new chiefs. So that was an interesting gathering as well, to kind of go through what was different from our previous roles to now. And there is a difference between, I served as essentially an assistant chief, the major in the department for a few years, and going to the different roles different. And a lot of us had done that. So it was interesting to have that conversation. We certainly did talk about, the COVID years and how they affected everything from mental health to staffing to equipment to getting squad cars, and are still affecting us to today.
Yeah. Now, the next thing I'd like to chat about will be a repeat for our viewers that were actually at the mental health breakfast, but I just think it's such an impressive story. It's how you were able to get rid of the copay if an officer was going to go seek mental health support, and how that inquiry led to a broader picture. Can you kind of describe that? Yeah,
we had a situation where during the COVID time, and it was a tough time for everybody, and I believed, or I at least felt, that the need for that EAP use was up, but officers were reluctant to use EAP for a lot of reasons. One, it was in person. We know half the town most of the time, so it's pretty rare we're not sitting out there with people we know. So we approached the city and asked about eliminating the copay for mental health care, so officers could go to their own doctors, do telehealth, which kind of blew up during the COVID year. So we kind of approached them, and they're very receptive to it. The Human Resources Department talked with the insurance carrier, worked things out. The elected body approved it, and so they eliminated mental health copays citywide. So no city employee if you need to see a psychiatrist, a psychologist, there's no copay at all. It's covered by the insurance. You go in, you go out, and you don't have to spend a dime because, if somebody's struggling and finances are an issue and now you're seeing a counselor 4 or 5 times a week, that $20 copay adds up fast.
Yes, it does.
And so it was kind of just a thing to eliminate that hurdle, eliminate that, hey, I can't afford that. So I'm going to put my health on the back burner while I take care of this. It eliminated that, putting your health on the back burner. It's kind of like the flight attendant, put your mask on first before you else anybody else. So
right.
We're going to take care of you so you can take care of everybody else.
That's
so that
wonderful.
was kind of the way it went. And my appreciation for the HR department, the Human Resources Department, and the elected body going through with this and everybody else in the city that supported it it's truly wonderful. And,
I think it was very enlightening to me to find out that something like that could just be done. It could just be taken care of. And the first year of the mental health breakfast, as I was going through the presentation, I dished out some challenges, and I'm actually going to take advantage of that right now. And for those of you that are viewers, I'm going to encourage you to take some action here and approach your own. If you're at a place of business where you do have a copay for your mental health, wow, it can change. Maybe it can change. And so if not for yourself, for some of your coworkers, go ask that question. Go to Human Resources, go to your administration and see if that's something that could be eliminated, because it happened in the city of Waterloo. So I think it can happen in other places too. I love that story. So also going back to, when I did the keynote address that first year, I talked about my brother Matthew, our story about the struggles that my younger brother Matthew faced, which led to drug addiction and eventually his accidental death, overdose of methamphetamine. And over the years, Matthew struggled with his substance abuse for about 6 or 7 years. And we got to know some Waterloo police officers during that time. And from feedback that we got from those people who attended the mental health breakfast this last year, one of the things that they were looking for were more resources, hints, tips, encouragement for the family and friends of people who are struggling with mental health or with substance use disorders that are tied to mental health. So I'll set up that, there were times when my younger brother Matthew would be high and I would get just disturbing text messages, and oftentimes he wouldn't answer a phone call. I was really struggling and living 2 hours away. So I would worry about him. And many times the thought came, I should call the police. But then the next thought I had was, okay, officers show up and my brother's high on meth. Is he going to get in trouble? I didn't know how it was all going to play out. So in just general terms, can you talk through if someone has a loved one out there that they're really worried about the welfare of that person, or maybe even the community surrounding that person, what does that end up looking like? If we call the police and say, hey, I'm worried about my brother, he's high, he's talking crazy, and I'm worried about him. How does that look from the police officer's end, and how does that process fall together?
Well, many times the family is the first ones to recognize that something's going wrong. I mean, they're the most contact, they're the most frequent, and we deal with that internally as well. So a lot of times the family's the first one. Many times we're second. We either encounter them having an episode or an incident or family calls, and the officers are well-versed in responding to those type of calls. It's a regular call for them. It's not anything outlandish. I mean, we go fairly regularly to substance abuse issues that are brought on by substance abuse or mental health issues, and they're comfortable in dealing with them. Sometimes it can end in arrest. Sometimes that's the reality of it, is it can end in an arrest, and that's not always bad. It gets them into a system that does have services. It points them in the right direction. The jail does a nice job with mental health services and substance abuse services. It gets them into a system, maybe not the ideal system. I think the hospital would probably be more ideal, keeping criminal justice out of it, but it does get them into a system of sorts when maybe the other one you couldn't get them into for whatever reason. You couldn't get them to come to the hospital. You couldn't get them to enter substance abuse evaluation. You couldn't get that done. So an arrest isn't always horrible. It may sound bad, but it's just the beginning of the incident. I mean, they could do rehab and have the charge go away. There's lots of options happens once they enter that system. So it's not always a bad thing. I would encourage people, if they're fearful of something, to call us and let us come out and evaluate it. The officers are very good. They know their job. They're probably 50 of them are trained critical incident evaluators or intervention officers, so they know how to deal with that. And that was something that started a long time ago, and it kind of went down and then came back up. And so we're back into that, and we have a lot of officers that are well trained in it, and a lot of officers that just have a tremendous amount of experience in it. Some of these officers have been doing this job for 25, 30 years. They've seen a lot of things, and they're very apt at changing roles on the fly and finding something that works. So as a general rule, arrest is kind of our last solution, but it is a solution. It is one of the tools on our tool belt that we have that's unique. So we can use that if we have to. It's not something that they run right in there and it's like, okay, heck, let's go. And even if they did do that, that's not the way the jail would operate. So there's always a second step, or the county attorney, or there's always direction there. So I would encourage family that if it's gone beyond to where you don't feel safe or you feel uncomfortable, you feel they're a danger to themselves or others, it's time to make that call and get us involved. It's too risky. There's too much at stake. There's too many stories of how things went wrong that I think you do need to involve law enforcement or another type of intervention. I mean, we do have several mobile crisis operations now in town that did not exist 5 years ago. So they can come out and start dealing with it, which is something we're pretty proud of, the fact that we have an embedded social worker, but we also have mobile crisis response, which will respond to other things within the community for us and leave us out of it.
Can you describe give an example of that, your mobile crisis units that you're...
A lot of times they'll respond to someone who is just feeling off today, maybe not dangerous, not armed, they're not going to get dispatched to a guy standing on the bridge saying they're going to jump. That's not their role. But they might show up and help if they can. But, somebody who's at home, is not armed, was thinking about taking some pills today, they'll go out and they'll deal with that, and they'll help. And if they need us, they'll call us. We also have Your Life Iowa now and all the situations that goes with that. So they can call a number and get connected right away with a counselor. So there's a lot of services that didn't exist even 3 years ago.
Okay, so help me understand how this works. If there's a person that's just low, contemplating taking pills, they don't have a weapon, they're not, is this... In the scenario that you're describing, have they called the police and then at dispatch it gets sent to one of these mobile units, or are people aware of directly connecting these entities that have mobile units that come? And what's the action reaction steps? How does that typically happen?
There's a lot of ways to get in that door.
Okay.
The way I'm most familiar with would be they'd call dispatch.
Okay, so they've called 911.
Or family would call 911.
Okay.
And sometimes dispatch will dispatch the call to our officers, and a supervisor will hear it and say, hey, dispatch mobile crisis as well. Okay. Because they hear the call and they're like, okay, maybe there's a role here that we can use them, or maybe it's more suited for their role. Dispatch mobile crisis if they're available. They'll do that. Sometimes dispatch will just, hey, we've got this call, we're going to send mobile crisis first. Sometimes people ask for mobile crisis. They've built relationships within the community, so they'll be like, hey, can you have mobile crisis come out? And they'll ask. So those are the ways I'm most familiar with, largely because I work through our dispatch center more than anything else. So
we would also have periods of time where we wouldn't hear from my younger brother at all. We used to refer to those times as Metheo, that he in Metheo instead of Matthew. And there might be 3 days we would understand we're not going to hear from him. He's high, whatever. But sometimes it would eke out a little longer than that. And again, living 2 hours away, I would consider my options. And I'm sort of familiar with what's called a welfare check. What is that welfare check that I've heard of before?
Normally that's something we'll do if someone calls concerned about a sibling in a house, somebody lives in a house, anything, we'll go out and check their welfare just to make sure they're still there. If they're not there and now they've gone missing, that's another avenue, and that happens in substance abuse issues as well, where they just disappear. They've left home, they went to the bar last night, and nobody's seen them in 3 days. That happens as well, and we'll look for them. We have a system we can enter them in to establish a nationwide look and start to find them, and at least make sure they're not endangered or in trouble.
Mm-hmm. Okay, so now I want to skip back again. When you were talking about sometimes the arrest is not a bad thing, and it opens the door for some services. Are you familiar with is there a certain person who typically does that? I know this is happening over at the jail, not with the city, but are you familiar with the person that typically processes people that have been arrested and need to be considered for mental health or substance use issues? Does that kind of thing happen right at the jail, or how does that typically go?
Yeah, I couldn't speak to the jail process. It's not something I'm involved in at all. I know they use a lady named Sarah Geiger who does a lot of stuff through Department of Corrections, okay, as far as critical addressing mental health issues and evaluating people. But I don't know how the jail process looks to get to her window. I don't know how that
Sarah
goes.
Geiger might be one that we want to have another
You definitely want to have Sarah Geiger.
Okay, all right. We might extend this beyond our panelists.
She's been doing this a long time.
Yeah, wonderful. One of the things that you talked about at the mental health breakfast and we shared was the community resource database, and that we received a lot of feedback on that. I think that was. I've had a couple of light bulb moments just chatting with you today. I know that was a light bulb moment for a lot of the over 700 people that were gathered for breakfast that morning. Can you just share a little, again, for our viewers that were not at the mental health breakfast, tell a little about that community resource database and how it's used by your officers?
Well, even when I started, we were kind of a funnel. We would get people to places they needed, whether it was the Red Cross, United Way, Catholic Workers House. We would always kind of have these places that, maybe I knew, but you didn't because I'd been there a few times, and we always had those. And over the last few years, we kind of formalized that, and largely, or not largely, but one of the pieces that allowed for that is the officers will have computers in their cars now. So it's a fully functioning computer, and they have on their desktop a Excel spreadsheet essentially, and across the bottom is tab after tab after tab of different, hey, I have a disabled veteran, click veterans, and it tells you all the services that Waterloo or Blackhawk County or even Iowa provide for veterans. I have a homeless mother. You can click on that, and it gives you all the services: domestic violence, sexual abuse, homelessness, drug use. I mean, I can't count. There's probably 25 different areas where you can click, and you'll get 5 or 10 resources. Some of them are 24/7 resources. Some of them aren't. We have some cell phone numbers in there for directors, because sometimes we'll deal with a mother and her child who are stranded at the bus stop, miss the bus, can't get out of town, hey, and we'll reach out and they'll be like, yeah, we'll get them a hotel. They'll make arrangements to get them through the night and get them on their way. So that resource list is pretty popular. We update it with new information. That was always the biggest, it's always the biggest thing. If you maintain a big contact list is, so-and-so left, now who's, but we try to keep the information up to date. And most of these organizations are pretty good about it. And they're big enough and stable enough that you always have multiple avenues into them. So, but we do have a lot of resources in this community that we call upon to help us do our jobs.
Yeah, that's excellent. And that was, like I said, that was just a really wonderful light bulb moment for myself and for a lot of people, I think, at the breakfast. One thing I know I do want to ask, I'm going to ask this, I'll be asking this of all of our panelists when they come on. We also talked about the concept of, as human beings, we are built to self-soothe, seek out ways to self-medicate, ways to self-stimulate. What do you do to stay healthy? How do you keep, you've got a stressful job. I don't know what you've got a life outside of your work. What have you found that you could share with people that helps you feel like your mental health is stable? Are there things that you do that soothe you, that stimulate you, that keep you leveled out? What do you go to?
Well, I've done this job a long time, and I've certainly experienced the ups and downs of it, and have been in, this job can swallow you whole, and I allowed it to on different occasions. I mean, I would just bury myself in work, and it's a danger of the job, and I'm very aware of that, because I'm very susceptible to that, to falling into my work and just go. And so I'm very aware of that and conscious of that, but younger me wasn't. So I would just go and do the job, and that's what I did, and I'd work 16, 18, 20 hours a day, and it was just not, and that was what the job was then, and it still is to a point today, but not like it was. So I'm susceptible to that. Everybody's got their chink in their armor, so to speak, and that's mine. I will dial in and I will dive in, and I won't even see what's going on around me. So I'm aware of that. I'm aware of that and what it does to me personally. So I try to have some separation. I I enjoy my home time. I try to keep. I've never policed my kids. I parented my kids, and I was always very clear. I never spoke to their class as a police officer. I never did any of that because I didn't want to be the policeman to their friends. I just wanted to be parent.
Yes.
So I've always kind of stayed out of that. I spoke to one kid's class one time, and I needed their permission to do it. The teacher asked me, and I said, I got to ask my daughter.
Yeah.
She's good with it. I'm good with it. She's maybe in 8th grade. So I very try to keep that separate because I always a parent on one side, police on the other. I'm not going to police my kids. So I've always kind of done that and kind of tried to wear, 2 separate hats. When I get home, I'm done. And it doesn't always work because my work can invade my home. I can get, especially now with cell phones, but I get phone calls and I spend a lot of time. So I have a lot of hobbies. I'm kind of eclectic in the hobby world. I do one thing for a while and then I go do something else. And I just, that's my nature. I probably became a police officer because I can't focus. I can't do the same thing over and over for 30 years. So this allows me to be eclectic in my job. And that's what I am. I cook, I do woodworking, we travel, I do things with my kids. I was coaching my kids' sports for years. Just kind of things like that to kind of keep me realizing the world isn't what I see every day. And I've been fortunate to develop some, largely through my children and their activities, develop some friends outside of my profession that allow me to see the world through their eyes versus, what I see on a daily basis. So those are things that help keep me kind of grounded. But I've had my struggles as well. I mean, this job's nobody gets out unscathed. I mean, you've got to take care of yourself and have the ability to get help when you need it and find it. And whether that's a pastor, a counselor, your spouse, something, but you've got to find that. And I would never take some of the stuff that I've seen over the years home to my wife. That's not fair to her. She doesn't have this job. So I'm very cautious about bringing my work to my house, and I keep them as separate as I can. I'm not saying I'm great at it because sometimes things overflow, but I do my best to kind of just keep a separation there. Doesn't have to be big, just enough of one.
Right. And, I think that there are very few of us who really understand what your world is like as a police officer, even separately, you being the chief of police. But I think that when you earlier were talking about each of those shifts kind of having their little family, the more I think about that, that's really a lovely model, because then that little family is made up of people who do know what it's like, who do know what it's about, to do that kind of work, and just that level of stress. And you talking about working long days, it's the health and welfare of our community that you've been put in charge of, and that's a lot of pressure. So. Yeah, good. Well, I'm glad that you're able to find ways to stay balanced. Woodworking, what's one of the last things you've done with your woodworking?
That's one of the ones that kind of fell by the wayside because I do my woodworking in my garage, and I'm currently remodeling my garage. So everything got put away, and I'm working on painting my garage and finishing it all off. So that's kind of been my sideline. I play a lot of golf during the summer, and that also, at night my wife and I go play golf. So that kind of cuts into my free time when I have it. So I don't really push projects anymore. Yeah. I grew up in a job early on in my life that was very task driven, and I tend to not like that. I like doing things at my own pace. I like having my own schedule. I'll get them done, but it's my pace. My job at work is task driven. It's deadlines, and so I try to keep that out of my house. But the last thing I built, I think, of substance was a entry chest for a friend of mine's house that they wanted to put their shoes and stuff in, and I built it for them just for fun. So it's something. It entertains me. I'm not great at it. There's plenty of better woodworkers than me, but it's something I enjoy to play around with and learn. And my wife makes fun of me because I watch 1,000 YouTube videos a day on different topics, and she's like, "Could you just stay on one topic?" I'm like, "No, I'm going to look at this and then look at that." So.
Yeah, but it's good to know yourself and to feed what you need to feel satisfied. So, Chief Joe, is there anything, both from the mental health breakfast experience that you had and just our conversations today, is there anything else, any other messages that you would like to share with our viewers that have come to your mind through this whole exploration that we've done of mental health?
Well, COVID affected us all in some weird ways, and probably a few good things actually did come out of it, and telehealth being one of them. You can contact a counselor. The city provides Doctor on Demand, which is a online telehealth service, and they have counselors. And so for people who don't want to go to the hospital where they might see their friends, or bump into somebody, hey, what are you doing here, and make this uncomfortable moment. You can do it from the comfort of your living room on your laptop. And that's something that is, to me, just incredible, just the access of it. Now, we struggle like everybody else with healthcare providers, and with mental health care providers even more. And so that's an issue, but I hope, in society, we have kids right now going to college saying, hey, that's what I want to do. And that need gets filled, and we have a good service network. We have some tremendous service providers in town, but they are stretched. And it's really refreshing to me that we have these conversations now. When I started, these conversations were not happening. They were not a conversation, and nobody's fault. It's just the way it was, and
right.
Society has changed and evolved, and I think it'll continue to evolve to where we get better at addressing these things and maybe a little freer in the conversation. I mean, I watch the way my kids talk about and deal with, and it's so much better than the way I would. So I'm very proud of where we're moving as a society when it comes to mental health, substance abuse, realizing the underlying causes, the underlying issues, and how to maybe address them.
Excellent. So I'm going to echo one of the things that Chief Joe said, talking about the shortage of our providers in the community. And those of you who are viewers, if you would like to help donate money, contribute to Black Hawk Grundy Mental Health Center, we certainly would appreciate additional funds to help expand the programming that we offer and be able to touch even more lives in our community. So I will end with that request for you to consider donations on that too. And we hope that you'll join us. We have all of our panelists we'll be trying to have additional conversations with, and it sounds like we might tap into some other people in our community that weren't invited on the panel that might have good things to share too. So keep watching for additional episodes to pop up.